Good afternoon, everyone. Thank you for joining us. We're going to wait a little while as people are welcomed into our waiting room. But we appreciate you having lunch with us if you're eating lunch. And we so appreciate having our District 21 representatives here to have a conversation. We'll wait a few more minutes or moments. So welcome, good afternoon. It's wonderful to be together to continue our conversation about how our community is responding to the COVID-19 crisis. And we are really lucky to have our district representatives join us to give us insight into what's happening both locally and also on a state level. But first, I just want to express our condolences to Senator Kean on the loss of his mother last week. I've been reading some of the tributes to your mom, and they've been beautiful. I didn't have the opportunity to meet her, but she sounds like an incredible woman, and may her memory always be for a blessing. And so I know our community is thinking of you and your entire family during this difficult time.
Thank you. She was a wonderful, wonderful person. She'll be sorely missed, and thank you. It's very meaningful that you would say that at the beginning of this session. Thank you.
And we're also joined by Assemblywoman Munoz and Assemblyman Bramnick, who we're proud to call a congregant at Emanu-El as well. So thank you for all joining us and being a part of this conversation. So what we've been doing usually to start these conversations is to check in to see how you guys are doing, both health-wise as well as work-wise. And I wonder if you can just share a little bit about how you have handled this crisis over the past 6 weeks or so.
Well, the family's all healthy. We are all at home. We have 2 daughters who are adapting to the online education and understanding how well, people are normally, we've not had people staring at the computer screen for the previous couple of decades, but now having them actually learning at the computer screen and integrating that into our daily life, it's been an interesting change, but we've been able to spend a lot more time at home together, and it's being home really 7 nights a week is something that's been new to the family, and that's been a really wonderful thing for us as a family. And other than that, we've been reaching out in a lot of Zoom meetings, a lot of phone calls, reaching out to people 7 days a week, whether it's from the state Senate legislative capacity or family capacity, where you're able to it's amazing to figure out the right ways to make time for having the conversations you need 7 days a week. Thank you for asking.
Yeah.
John, you want to go next? Or want me to go?
Go ahead,
Okay. Well, I'm fine. Excuse me. My youngest son, who's in healthcare, he had presumptive COVID. They cut off their clinical out. He recuperated, quarantined, and the house where he was quarantined, the mother at that house also, she tested positive for COVID, and she's about my age, and she recovered and did well. I've been very busy. I'm testing at the Union County site at Kean University. I'm at the parking lot there almost at least once, or not twice, to 3 times a week. Really interesting part of this whole, having a perspective on how this affects the people, and getting right face to face with those who have symptoms, etc. And also, not doing that, making masks and giving them to those who need them. Hold on a second, my son's just coming down. He's finished an exam. He just took his neurology exam. And as Tom said, keeping up with our constituents and making sure that we participate in that. My daughter's 30th birthday is today, and trying to keep in touch with our family. I have a grandson who's due within the next day or 2 or 3 in San Francisco, so anxiously waiting that. Unfortunately, won't see him for a while.
Thank you for your work at the university and swabbing people. I know that's a huge help to those people, and so I thank you for that work.
Thank you.
Good afternoon, Rabbi. Patricia and I are doing fine. Thanks for asking. The limitations, obviously, of seeing grandchildren, but I was thinking the other day when I went to a bakery and I had my mask on, I came out of the bakery and my wife was videotaping me coming out of the bakery with the roles I was going to bring to my grandchildren. And they were watching that. I'm thinking, what impact does that have on a 5-year-old? Because she's going to see people with masks. I mean, this is nothing you can hide from people. So it reminds me of when we heard stories about the Great Depression from our parents. And then the impact on the grandchildren in a situation like this, you can just imagine 50 years from now, that's an image that's going to be in their minds. So I think fortunately, we're doing well. We're being real careful as we age. I'm a little older than both of my co-assembly and senators here, or senator and co-assemblywoman. So we're being more careful than most, maybe. But let's put it this way. When I grew up, there was kind of nothing to do in the late 1950s. So I'm very experienced of doing nothing. There was only 3 channels, right? You went around the neighborhood and everybody was outside, which actually is interesting now. As I walk the neighborhood, everyone's out front. I haven't seen everybody out front since 1958. So I get to actually, and it's interesting, no matter who the neighbor is, you can stop and chat 6 feet away with your neighbors. So it's very difficult. I think it's more difficult on people that we don't even know about yet, but we're doing what we can to help people as members of the legislature.
I'm glad that you're all healthy and that you're able to continue to work and connect with your loved ones as well. I forgot to mention that if you want to ask a question at the bottom, there's a Q&A question that you can send me a link, and then after a couple of my questions, we'll open it up to conversation from you as well. So I was hoping that you could kind of, we hear a lot on the news, we're reading a lot, but can you help us like have a really zoom into our own district and what you're hearing specifically in our area? What's happening with the testing, what's happening with the rates of COVID-19 and the response specifically in our District 21.
I'm happy to let Nancy talk about testing, but I'll talk about when I speak to the hospitals, and I try to talk to 5 hospitals a day. There was a point where the hospitals were at maximum capacity or just shy. And now we see a slight reduction of people hospitalized, which is obviously a good sign. So the social distancing is working. Nobody feels we're out of the woods, but every time I talk to doctors, they seem much more relieved now than they were 10 days ago or 2 weeks. So I think that's a good sign.
And I agree with John's right about that. The one concern we do have in healthcare is that the emergency rooms separate from the COVID are pretty much being underutilized. And the healthcare workers are really are worried that there's been people having silent heart attacks at home and not going for care, having a mini stroke at home, not going for care. I heard a story on Tuesday when I was at the testing center. One of the nurses there, her neighbor died of a ruptured bowel, but because he was afraid to go to the ER. So we're going to have, what I think we're going to see going forward is a little bit of a surge in other things. But as John said, the number of COVID cases in North Jersey seems to be plateauing off. John, Tom, and I were on the conference call yesterday with Rutgers about the rapid testing, and I'm sure that they can speak to you about what we heard there. Because, you know, as a person who's at the testing center, we see, like, one of our busiest days, we saw 717 people. We're a state of 9 million people. To do 717 in a day, we're just not going to get there. So it's a good thing that Rutgers is taking the lead on this and is finding a more rapid way to test. And everybody has to drive to the testing center. And we started sending ambulances out in Union County to go to those who were homebound, who can't have access to a car to get to the testing center. So if we can, if under the lead of Rutgers and with the labs, if we can have a more efficient way of testing, a faster way of testing, in a way to reach more people, because I think that's the key. We have to be able to get more people tested to actually start to move forward in the state.
In addition to what John and Nancy were just talking about, one of the things that we're hearing a great deal in the district is the unemployment issues. I mean, we have, I think, between our 3 offices and more, 500 plus unemployment cases that we are diligently working on, and more to come. We've read a lot of headlines about the technology and the delays in that regard. And one of the areas in this area is the ambulatory healthcare services, is the generating the largest number of UI claims in the 21st legislative district. So as we're looking at ways to get to help people that John and Nancy both talked about, dealing with that area of the unemployment concerns is the thing that we are working on every day, because while the state budget is looming and it's been delayed a little bit, so we'll be able to delay that by 3 months. The day-to-day constituent services associated with unemployment claims, job creation claims, making sure that you have everything from the telemedicine to the continuation of the school day. All those things are going on legislatively. But the day-to-day concerns that we're hearing in our district office are the unemployment issues and making sure that there's predictability within that. Those are the things that are impacting us on a day-to-day basis, in addition to making sure there's more testing sites. And John, Nancy, and I have visited a couple of the testing sites. That we've also made sure that, again, working with the hospitals to make sure they have what they need on a daily basis. And as John was right, that they were starting to plateau down a little bit. Now we've got to focus on what the next stage of this is going to be.
So are the hospitals, do they have all the needs right now? We heard earlier, when it was a steep incline, they needed the necessary protection that they were not having. And I'm wondering, is that still an issue, or have we been able to remedy that because of the increase of production, or because of the slowing of the people in the hospitals getting admitted?
What I've heard, it's still a concern because there are certain medicines, certain drugs, certain equipment, depending on which hospital you talk to. They always seem like they're just on the edge of running out, and they sounds like they're always improvising. So I think it's still of a concern, but with the plateauing of patients, they're not as panicked now as they were.
And I think I would agree with John and that the hospitals are learning to adjust too. As we said, the number of non-urgent care has gone down. So this elective surgeries have been canceled. So the hospital census has actually gone down, where they're using areas for ICU that they would otherwise not use. And they've been very innovative in how they are treating the patients. They set up teams and they set up runners who stays out of the room so that you don't have to change your equipment every day. So the good American spirit is to be innovative and to adjust. Redeployment of nurses, as Tom said, is all those surgery centers and those practices, those are the unemployed healthcare workers, and we're trying to redeploy them to other facilities. So it's, John's right, and and we have gotten more equipment and we've become more innovative. But again, I think we're going to see a surge after this of other things.
And we need to continue with the testing, making sure we get tests that's accurate and quick to analyze. We also need to make sure, depending on the hospital system, whether it's a PP issue or a supply chain in the medicine or a variety of other things. The answer is different depending on each hospital system. And that's one of the things that we do as state legislators, is make sure that on a daily basis, we are paying attention to the needs of both the hospitals, the healthcare system, and the constituents in that regard.
I can tell you that generally, the legislature is working together, pretty unified. You always have a few people on the outskirts, but generally speaking, we've come together pretty well and tried our best to all join together with the governor to try to solve the problem.
Can you highlight some of the bills that have been passed that you've been working together on, and what you see down the line as moving forward to make sure that we can open up or be as safe as possible in our state?
Go get him, Tom. Go ahead.
Well, the legislature, I believe, is probably one of the few that is operating remotely. And one of the things, so the last time I believe I was in Trenton was March 17th or something like that. So the ability to have an online remote legislature means we can operate in real time in ways that other legislatures cannot, and be very responsive and predictable in finding the solutions. In our next legislative session, I believe, is the 15th of May. But what we've done already is we've been very COVID focused and pandemic focused. And so the first thing that we started to focus on, we're making sure that things like telemedicine could occur, making sure that you had a continuation of the education process going on, making sure that also that those that needed the participant in the before school or school lunch programs, that those needs were met in every single zip code, so that there was an emergency plan by every single school district. So we were making sure that the healthcare needs were met, the education needs at 180 days were met for the students, as well as the food they would need. We also made sure that the small business efforts were from the state level addressed. But this is an ongoing concern, and one of the things about having a remote legislature allows us to continue to meet the health, the education, the economic needs of the constituents, while also making sure that as we transition into the economic side of this conversation is how do we reopen? And I think the parks and the golf courses and other entities, the shore, the beach this weekend is good as people are responsible and maintain their distancing. That's a very important first step and good signal. But we now need to say, what are the next steps? How are you going to open up the things like the elective surgery? How are you going to open up other entities to provide the type of education, the type of job creation, but also make sure you have safe daycare, because you can't have an economy that's open unless you have a daycare system that is safe and people know that it's safe. So I'm not sure that we've done as much focus on that from an executive or a legislative branch yet, but that's what we need to focus on, is making sure the daycare system and that those are safe.
We also understand that at some point, if the schools don't open, people can't get back to work. This is a balancing test. This is balancing, can society continue to function economically and otherwise in an environment that we're also protective of people's health. And I think we're going to have to come to that balance relatively soon, because there are incredible pitfalls if you don't begin to open the economy, and there's can be tragic results if you open it too quickly. But I think what's changed is, a month ago, people were not afraid of this virus. Now people are. And as you walk down the street, people will cross to the other side of the street generally. 6 feet's not good enough. So I am pretty optimistic that people understand it's serious now, and therefore we can begin to do things to open the economy in a gradual, balanced way. But we needed people to understand how serious this illness was before we could move towards opening.
So one of the questions, or what we've heard, is that testing is really the way that we can start opening our state. And this is a question that came from a participant. In the absence of vaccine, we need testing, which you have mentioned. When do you anticipate capacity growing locally? And what do you consider an acceptable percentage of level of testing of the population? And when can you anticipate reaching this level? And when do you anticipate reaching that level?
Well, that was the question we asked yesterday, and I don't think we have an answer yet. What is that percentage? And you're absolutely right. The capacity is the question. And like I said, right now with the current testing, with the swabbing, we pat ourselves on the back when we hit 717, and that's clearly not enough. And we have 9 million people in the state. So the rapid testing that we've, the new test that we see coming out of Rutgers, with a saliva test that you don't have to actually go to a person, but still you're going to have symptoms. And that's the thing. Right now, the only people who are being tested must be symptomatic. They're not testing non-well people. So we don't know that I haven't had it and haven't had symptoms. So we're going to have to look at that, the antibody testing, and find out about how we do that. And contact tracing is going to be important too. So what do we do once we know? For instance, I told you that, where my son was living, the mom in that household had it. So that contact testing, the 4 adult children who were there, they quarantined themselves. But how many other people did she come in contact with? So it's, from my understanding, we're going to need like a large number of people who are going to be taking part in the contact tracing, because that's how we're going to see who did you actually come in contact with. So you're right, the vaccine, which we're working as fast as we can. Number 2 is the testing, how to increase capacity, and how do we get that up to a time frame that's reasonable, because right now we're waiting 5 days, 3, 5, 7 days to get test results, and contact tracing, and then the antibody testing. Have you been exposed? And do we know whether, if you have been exposed and have developed antibodies, does that keep you from getting it again? And nobody seems to know the answer to that yet. I mean, we know if we get certain diseases, we don't get it again, but we know we get the cold, we get it again. So we're not sure, if your second time around, it will be less if you are immune. So those are questions that we don't know, but those are the components that we're going to need from the healthcare side in order to really have like confidence that we can go forward and resume, as John said, not walking on the other side of the street from each other. Everyone, there are, like my street in Summit, it's like, I say it's like Fifth Avenue because everyone's walking up and down the street, which is great to see because there's families together, but they see each other coming and they go across the road. So at some point we're going to have to get back to a more normal way, our normal.
Rabbi, the science, it's going to be hard to tell you the perfect time that science is going to support our decision making. But I can tell you this, and Governor Cuomo said it pretty clearly. As you slowly open up society and you start to make those decisions, you start to see whether there's a recurrence. We would like to have perfect testing. We would like to have the perfect number to open up society, but we know we're not going to get that in the short term. So as they open up the parks slowly with just walking and running, or they open up golf courses with social distancing, and they start opening some more retail stores, if they see that this creates a new pandemic or a new resurgence, then they're going to have to pull back. That's why opening all of a sudden with a broad-based opening is a big mistake.
Have you been working on that contact tracing to help us navigate it? There's a lot of funding probably that goes around that, or there's also privacy concerns too. I'm wondering how that, what the legislature is thinking about on that.
Well, we had contract tracing is a really important part of this process. In addition to making sure the testing, making sure there's also the research that's being done in New Jersey. We've got the best biotech, best pharma, but most highly educated workforce that exists in the country. And so we are going to be on the forefront of answering many of the questions that John and Nancy, you were just discussing. But we also need to focus on, at one point, Westfield and some of the surrounding communities had a localized board of health that had five or six towns in it. And you had 1 or 2 employees early on as more and more cases were coming. And so the contract tracing is a very person heavy focus to figure out how to the contacts over time and making sure you can verify that. And so making sure that these regional entities that have been may not have focused on as a region or as a state with as much resources as we need to, is making sure that you have the contact tracing at the exact same time you have the testing ramp up, at the exact same time you have the research ramp up. And if people try to have in their mind's eye, when's the next time one family is going to feel comfortable sitting next to another family in a theater setting, for example, right? And that's the type of things that we have to figure out going forward. And what are the technical things we need to do for taking temperatures and checking those types of things over time, but also what are the practical things that we need to do for both the research as well as making sure they don't have a rapid rise in this again.
So a question just came in about, we know that unfortunately a lot of the COVID-19 patients that have died in the Westfield community have been at nursing homes. And we've seen a tremendous amount of sick elderly people in those homes. And so what is being done around nursing homes? How are we holding them accountable and making sure that the staff there has enough resources, but also that our elderly are safe in those homes?
You want to take it, Nancy?
That's
I'm happy to do it. But
go ahead. You start, and I'll see. Go ahead.
well, I think the state probably got off to a relatively slow start in that area. I'm not sure that people believed how serious this was, nor how contagious it was. So when it did hit the nursing homes, it hit with a roar. And you had people coming in and out of nursing homes. So once it began to infect a nursing home, I think it was hard to stop. Now, of course, there's all kinds of rules in place, whether they be masks or taking temperatures of people coming in. But unfortunately, that virus got in there before the necessary steps were taken generally. Now, I'm not criticizing anybody here. I mean, we haven't had a pandemic in 100 years, and I'm not sure what other states did early, but once it got in there, you can imagine how difficult it is to get it out and get people out and move people out. I mean, this was a nightmare of proportions that we had never seen before. Right now, I think the health department's all over it, and hopefully they can at least stop the further spread. And they've put 100% effort into it. Once again, I'm not criticizing anybody in the state on this. I'm just saying that I think it got ahead of the state.
And you know, the nursing homes are a unique environment because it's a home made up of elderly people who oftentimes have many comorbidities. And John's absolutely right. The state, what they could have done maybe better was when we talk about cohorting, which is putting all of the people with the same illness in the same area. So rather than mixing them together. And what we also know about nursing home staffing is that many of the staff people work at multiple nursing homes. And that's just the reality of economics of who works in nursing homes. And so it was easy to see how it moved from place to place. The other thing is, you know, some people, it's a really difficult situation. And John's right, now the state is on it. I think some nursing homes made mistakes trying to hide the numbers. There's also a lot of things. The elderly they're more susceptible to this because of their comorbidities, their age and their inability to fight it off. Their immune systems are compromised. They're oftentimes, you know, compromised immune systems have an inability to develop a fever. You know, all we talked about was a fever. And if you're immunosuppressed or very elderly, that's your body's way of protecting yourself, and the bodies lose that. So they got behind in so many ways. And as John said, now we're all over it on the state. We're getting the equipment there, making sure we do all the testing. You know, it's really difficult also to say to a family that you can't see your mother. The other thing, they criticize people for sending the elderly back to the nursing homes after they came out of the hospital, but those are their homes. So again, to cohort and put all the patients in one area together, those who are ill, those who aren't ill, those who have symptoms, those who don't have symptoms, they needed to rearrange some of those beds. And I think they're busy doing that now.
Changing topics a little bit, the pandemic continues to highlight the stark inequalities in our country, especially the economic and racial disparities within our communities. And so I was wondering, what could be done for the people participating in the areas of the economy who are not helped by like the federal level programs? So specifically, perhaps house cleaners that might be paid under the table, even though we should be paying them over the table, or undocumented individuals as well that might not be able to collect unemployment or other things as well.
I think the legislature has come together in a very aggressive and inclusive way to address a number of those areas, and a number of those areas within the economy. You know, housekeepers and nannies are considered essential in this economy. But I think, as you've seen, we've focused on everything from renters to making sure that we have students and those on Medicaid. I mean, we've been really aggressive in making sure that we address the financial side of this. And we need to make sure that those individuals are continue to collect demographic data as well. I mean, one of the things we've tried to focus on as well is just like we did with making sure that I think the legislature and the state has realized that the health disparities that exist among different segments of the population while in giving birth and everything else, we need to have the exact same demographic data here to make sure that all ends of the, everybody within the economy, everybody within the society is best protected, and that we make sure that people have a job that is sustainable, predictable health care, and that we can make the state more affordable for people at every end of the economic spectrum.
And everyone can help by donating to a food bank, community food bank in New Jersey. We did a fundraiser for recently, but there were lines. There were hundreds of cars in line at the food bank because first and foremost, as we say, we want to make sure people can eat. And there's no questions asked when you pull up in this car. So fundamentally, we want to make sure people can eat. Second, I think the urban mayors, where we see a lot of poverty, they've worked really hard to make sure they bring resources into their cities. The question of disparity is going to be a long-term goal of our society. In the short term, we have to keep people alive.
I absolutely agree with John about the food banks. You know, every day I go to the testing place, they bring us food, you know, which is really terrific. But I tell everybody, contribute to the Community Food Bank of New Jersey. They're a great distribution center for the food banks around the state. And, you know, it's the people who actually really need the food who we should be contributing to. I send my donation there. I do it. Encourage all my friends to contribute to the food banks, because John is absolutely right about that. And going forward, you know, we as a nation have to make sure that we do things to make people healthy so that we don't have those comorbidities. You know, that's what we can, you know, work on as a global health thing within our country, so that we don't have the diabetes and the obesity and the cardiac disease, which makes you more vulnerable for this. So that's all part of, you know, primary health care and making sure people are healthier, because those who are healthier are less likely to get as sick from this.
And I'm hoping that we see less hostility out there from, let's put it, I'll call them the crazy political voices out there, because instead of complaining and criticizing whoever you don't like this week, just help somebody. As Nancy said, donate something, help your neighbor, and quit just yelling political statements out, which I'm happy, at least we have less of that now. Maybe it's the only redeeming value.
And if people are afraid to go, I tell people, if you're afraid to leave your home, you can donate online, which is the good thing, because, you know, people say, you know, I do a lot of volunteering, so do John and Tom. But I say, if people are afraid, you don't have to be afraid to go on your computer and make a donation, because that's one way that you can help without actually physically knowing how to sew or knowing how to make a mask. You know, you can make a donation.
Something we're proud of at a temple.
Also, food collection. There are also food collection sites.
Yes.
All across this county and surrounding counties. And I think the most important thing that you can do, as well as in addition to giving to the food bank, there are food distributions baskets, and, you know, across and then, you know, across our 21st legislative district, and being able to do that as well, because the food insecurity is real, and it to be, you know, that's one of the things that we need to address for the next, obviously, several months and several years. But that in food insecurity, in any way you can get that done, is important.
Right, and something we're proud about at Temple Manuel is that we've been feeding about over 100 refugee families that have come to New Jersey through our Westfield Fund Club. And also in the coming days, the Westfield Houses of Worship will be doing a food drive, I think in May, for the Westfield local pantry as well. So, you know, please stay.
You've been doing heroic acts for years,
yeah.
and I think that's an important thing that is now coming out, and people are understanding more and more, is the way that a neighbor can help a neighbor, and having that type of community and that type of vision is extraordinarily important. So I want to thank you for your leadership in that regard.
And when you walk by someone, smile at them, would you?
Yeah.
You know, when the people walk by, okay, you're not going to catch it from smiling from anybody. You know, that's not how you catch it.
Problem is they can't see your mouth, John, because you have your mask on. So you
Well,
crinkle your eyes.
I actually have a question, Nancy. You know, when you're walking and you're near no one, my concern with a mask is, right, if I'm not going into, I'm touching it, I'm taking it off, I'm putting back on. And if I had a different mask every few minutes, it'd be different. Right. So when I'm walking, as I said, just by myself, I have some concerns about dealing with, you know, you have to have enough masks that are clean.
I agree, and I was only kidding about not seeing your
Okay.
smile, because
I
I
don't
don't wear a mask either when I take my walks, and I
Okay.
just cover, I keep it strapped. Mine's sitting right here. I went to the store to get my daughter something for her birthday at a fish market, and I just keep it hanging around my neck because people get anxious. But you're absolutely right, John. And the other thing is, I am a strong proponent of people should not be wearing gloves where they're wearing them. They have a false sense. The gloves have the virus on it the same as your hands.
Right.
You're more likely to wash your hands. If people are walking around
I agree.
touching the gloves on everything, touching their face. I mean, it is, the gloves are a false sense of security. They're in healthcare. We change that, just what you just said, John.
Right,
We
right.
change them between patients. People, like, I see people with gloves on and they're touching everything, and then they're, they have the same gloves on all day, but they're not washing their hands
I
with
want
the
to
gloves.
make sure Tom's not eating too many jelly beans, because he's a big jelly bean person.
Yeah.
So, Senator Kean, you talked a little bit about demographics, and so there's a question from our congregation about the census and how we're doing in this district on census participation, and what can be done to maximize the number of people participating, especially during this time.
Well, I think everybody needs to, I think that we may very well have a delay in the census counting. And I think that is something that people recognized. In the state legislature, we passed an effort to make sure that everybody was counted, and we had a huge effort on to make sure that in every single zip code and among every single demographic that people would be counted. And I think that we need to continue that and making sure that people feel comfortable answering the census, but it will probably be, my understanding is, delayed by a couple months for the count to come out. And that's an ongoing process, but we need to make sure you can write, obviously it was very strange when the envelope came in.
Yeah.
An entirely online experience for the first time. I was looking for the return envelope or the return everything else, and the fact that you can focus on making sure that people have answer that thing online is important.
We have another question coming in about discrepancies between school districts regarding online virtual learning. They say in Westfield, they are essentially providing assignments for children to complete on their own or with assistance of parents and siblings. The teachers are doing some virtual meetings, but it's not a full day of teacher learning or even a half day. And this is putting a burden on many parents. But her friends who lives in Mercer County told me that the kids are now on virtual classrooms with their teachers from 9 to 12 every day. And so is there anything that
that's a good question. We passed a bill, but I'm not sure that in that bill we indicated minimal hours. So we have to check with the Commissioner of Education. Tom, Nancy, you may know exactly whether there's a mandate from the Commissioner on exactly how many hours of virtual teaching you need.
I do. And the other thing we realized, because one of my staffers lives with a woman who's a teacher, is not every household has a laptop per child or a computer per child. And that's, so that's an issue. So I think that's, John, that may be why they need to space it out a little bit, because you might have 4 children and, 2 desktops and a parent working from home. So the logistics are difficult. So I don't know that there is a minimum number of hours.
Is there a minimum, Tom? Do you know?
Well, there's not a minimum number of hours each day. I mean, the goal, purposely is to make sure we get to the 108 days, because right now, obviously, people are not going to the classroom. And we made sure that the Commissioner, Representative, had a set of standards and metrics that he was supposed to set for every single school district to make sure that there were that the teachers and the administrators were doing within their communities what they were supposed to be doing, was making sure that the kids are educated. What I'm hearing with great concern is in some of the cities, some of the things that we've heard regarding, because part of what we try to do was not just the education side, it was also the food side, and making sure that those individuals who were having the school lunch programs and things like that, to make sure that they could actually be getting that. There's a drop off in attendance and a little bit of accountability in some of these school districts that we're looking at right now. And so I think one of the things that when we do come up for air as a legislature, I know that I'm working with Senator Sweeney to make sure that we have an analysis to understand the accountability within the education system, making sure that it has been done the right way, but also what's going to happen next. Because I think one of the things that we need to learn from this current circumstances we find ourselves in is at the next step when this could happen again, either whether it be in the fall, because people don't know if it's going to be coming back like the Spanish flu did, or if it's going to be gone. There are things that we have to set up structurally to make sure that there is actually consistency, predictability, and success in the education process, because we cannot afford to have a 3-month gap in an education process. That's a generational change that will have an impact, whether it's on the preschool or college level. We need to make sure that you've got to get, and everything in between, we've got to make sure that there's consistency within that, accountability within that. And one of the things about the online experiences is you can actually start to measure that in a better way. But right now we're doing it real time.
Rabbi, we're going to give you our emails at the end of this. So specifically on the question of certain school districts not providing, let's say, the same virtual learning that other schools are, we can get an answer directly to the person who's listening. So we're going to we'll give you your emails, and between us and the members of our staff, we can respond to these questions.
Wonderful. I did get a comment that Westfield does provide Chromebooks for all students. So that's good to know. Thinking about the future a little bit in the upcoming election in November, there was a question about your positions on mail-in voting this November, as well as how we make sure that everyone's vote is counted.
I'm happy to answer, unless you'd like to take the lead, Tom.
Sure.
Well, look,
Or actually,
go ahead, Tom. Tom's running in November. He gets
it's not just
first
November
dibs.
too, but it's also elections, right? There could have been a primary coming up in.
It's also July 7th. And one of the things that people are looking at, Senator Rice has been very concerned. He represents a big chunk of Newark, and he's very concerned about spacing out of polling sites and the ability of individuals to vote real time. But you're also seeing real time in Belleville and other places. I think it is VBM ballots that are literally left outside and on top of mailboxes. So there's no accountability in that stream. I think that, and one of the concerns that people are having right now is there are 2.4 million unregistered voters, and anybody can vote in the primary if they show up and vote. What that would mean, though, is you had a absentee ballot program that went to every single unregistered or unaffiliated voter. That would mean that every voter who is not registered as a Republican or a Democrat would get 2 ballots in the July now primary to fill that out and only return 1. It would be a great deal of unpredictability and consistency, and you'd actually have to track those down. I think the question is, how do we make sure people are safe? I believe the hybrid approach is good. We've got a very strong vote by mail system in New Jersey, early voting, making sure that we've got predictability for those who have voted before by mail. But you've also, I believe, have to have the in-person experience for a variety of reasons. I think historically, I know one of my wonderful experiences has been going my daughters to vote and having them understand the importance of the voting process, but also, before this time when people were at home a lot more than they had traditionally been, that you would see, it's the one time you'd see your neighbors and you'd be able to actually see your fellow parents from the school system and everything else. So I think having an online system like New Jersey's had, I think the governor is prudent to delay until July to make sure we can figure this out. But to have a mandated vote by mail across New Jersey, I think I don't think would address the issue. So having a continued emphasis on making sure you have both VBM as well as the in-person experience while protecting both the poll workers, but also the people who are participants. I think we can address that by July.
We don't want to be like Wisconsin, where we have heard that people who voted were contracted COVID-19 from the primary location.
But that's why we've had, right here in Westfield, the county building, people can vote people vote and drop off weeks in advance of that. So you would never want to force an in-person experience, which is why New Jersey has been really at the forefront of making sure we have a no excuse balloting. You can mail it in for any reason. You can actually show up early at the county building right down on North Avenue. So there are things that we are doing in person. But my concern is you also need to have the in-person experience that I think as an option, because it's a very different system than Wisconsin. It's a very different system than even New York would. And New York had no excuses up until this up until this year. And they were all in person up until a couple months ago. So New Jersey historically has had a very different open, accessible system, but people should have the option of doing either approach.
Right.
Robert, obviously health comes first. Decisions need to be made based on health primary. But in the perfect world, there are concerns about vote by mail. When you send 4 or 5 ballots to a home, the question is always about privacy. You may have one person in that home who is very enthusiastic about how other people vote. I cannot assure the privacy. I'm not stopping vote by mail, but I am saying it is surely less private in many circumstances than it is in a voting booth. And we have instances of that. There actually was an indictment, I think, when Governor Christie was U.S. Attorney. They had an indictment regarding that kind of mailing ballots and how they were controlled. So, you still have to think about that privacy issue, but you're not going to put that ahead of health.
That's the decisions we've been trying to make as well, not about voting, but also about gathering and thinking deeply about what this fall looks like for our congregants and the high holy days. There was a big decision this past yesterday from our movement, reform movement, about camps for the summer, which they decided to cancel because of the health. And that's something that we are always continuing to think about too. So we have time for a couple more questions. I know I don't want to thank you for all your time. This one comes in asking, will you stop private equity firms from buying more healthcare businesses in New Jersey?
My answer is I don't know.
Yeah.
I mean, I'm not a finance person, and I'm just not, I'd have to learn a lot more about that.
And then a question of,
I think the issue will be, getting back to a little bit earlier part of the conversation, is making sure we have the right accountability measures. There are extraordinary gaps in a variety of different industries, in a variety of different zip codes, and in a variety of different, wealth areas and poverty areas that we need to address. That the significant gaps in care and gaps in accountability that we've now started to find are addressed. And so I think the question will be, as we come back as a legislature and come back as a society into emerge from this, is what are the standards of accountability to make sure that people are protected when they're, whether it's in the nursing homes or in the healthcare system or in other areas. That's what we need to start to address right now.
So we have time for one last question. I always like to end on something good and something hopeful. And so we've seen our communities come together and individuals going out of their way to support loved ones and strangers. I was hoping that you could share a moment over the past 6 weeks that gives you optimism or hope. And so to end on something that's positive for our community.
This is, people have come together in ways that have been extraordinary, and they've supported people that they've never met. Whether I've been to a host of food collection sites and food delivery sites, whether they be on Meals on Wheels, which I've traditionally done for a number of years, based out of Summit, or going out in other parts of this legislative district, where individuals are there helping, and the wave that you see amongst people, and the willingness of individuals to be, as we talked a little earlier, to do their good works in these uncertain times. It's really been important to see and wonderful to see. And I think it's a way that, as I think some of us have talked about a little bit earlier, when people remember this time, it will be the times people spent with their families. It's time people spent with helping their neighbors, that people, I think, will start to see. And when you look at some of the food collection sites or some of the food banks that we've been to, those individuals that you've talked about earlier about what you've been doing here, those are things that are really, really important and really helpful and uplifting to us. So thank you.
You want to go
What I
next,
have
John?
found is when you receive the call from someone and they simply say, how can we help? You see a lot of donations, and many of those people are not talking about their donations. They're just making those donations because I'll get a call and they'll say, where do you think we should send our money? That in conjunction with a concept that if we disagree during this period of time, that we disagree in a way that seems to be a lot more considerate than we used to. And I do feel as if people have a little bit more forgiveness and forbearance than they did 2 months ago.
And I, as a person who's under the tents working and doing the testing, what I see is, first of all, that people are terrified, but they're grateful for anybody who can give them the help. So, I've seen the people come together who are willing to volunteer. Those of us who are there are volunteers to do it. And I've had older women who have blessed me, and they put up signs in their windows and they say, God bless you. And almost all, they give you a thumbs up when they leave, and we say, we hope you feel better. And I think you see, like, as John and Tom said, there's a coming together of the community, and there's a sense that people, we're all working together and doing whatever we can do to help our neighbors. And it does, in a small sense, remind me of post 9/11, where, as John said, people weren't it wasn't so politicized. It was like everyone came together as a nation. And I happened to have been there on Tuesday when the Blue Angels and the Thunderbirds flew over. They gave us they're coming over. They flew right over our testing site. And I have to tell you, it took my breath away. And it took all the healthcare workers' breath away who were under the tents. We stopped for a moment, and it brought tears to my eyes, but it made me believe that we're going to get through this. And again, the people, all of us, from the National Guard to the nurses to the volunteers, everybody there, and the people driving the patients. We tested a 1-month-old. Her birthday was 3/13/2020. I mean, think about that, from 1 month old on, and they're all grateful, and there's a sense of community that really, I think, is important. And I hope that we can hold on to this sense of community going forward.
Unfortunately, we didn't get to all the questions, but I'm going to share your emails in the chat. Are they the nj@alleged.org emails?
Yes.
Great.
Yes.
So I'm going to send that right now to everybody. So that's in the chat. And in Jewish tradition, we have a term that we say, b'sha'a tova, in good time. And we say that to people who are pregnant. Instead of a congratulations, we say, in good time will you have a baby. So we hope that your new grandchild comes in good time. But also that we will be together in good time, b'sha'a tova. And hopefully that is soon, when all of us can be healthy. And we thank you for all of you doing this holy work to represent our district and taking the time to speak with us today. We are grateful for your time and grateful for your leadership. So thank you. And we hope that you continue to remain safe and healthy during this challenging time, and doing what's best for our district and the people of New Jersey and the global community as well. So thank you. And thank you everyone else for joining us this evening or this afternoon. Have a great day.
Rabbi.
Thank you. Thank you, Rabbi. Right, John.